And welcome back to House Call, and now we have our segment, Should I Worry?, where every week we talk about something that worries us. One viewer writes, I've been recently diagnosed with severe anemia. My internist has determined that the most likely cause is the bariatric surgery I had in 2005. Should I worry? Dr. Samadi, first of all, what is anemia and how do you know if you have it?
One of the best questions we've had through email. So anemia is basically low blood count. Red blood cells, basically the source and reservoir is in the bone marrow. And sometimes you may not be making enough because of many reasons. Somebody may have leukemia or lymphoma, or the bone marrow may not be functioning, or you may be making a red blood cell, but the body and the autoimmune system can get rid of those cells. But this particular anemia is very interesting. This is somebody who has had a gastric bypass, and now within the first year and maybe longer, they may have this anemia, folate, vitamin B12. And the reason is because when you have surgery, you bypass the beginning of small intestine, the duodenum and jejunum, and that's where the iron actually being absorbed. So you're bypassing the whole area of small intestine that iron would get absorbed. The other thing that you need acid, and that's whoever created us, God, basically had everything in place. You need acid from the stomach to be able to absorb iron. If you're going to make your stomach smaller, you're not going to have enough acid. You're not going to produce those factors called intrinsic factors. So you're basically your vitamin B12, folate, and iron will go down, and that's
Mark, what do you do about that? I mean, can they give you acid, injections or something to help anemia since they
You get that from anxiety at work. You get that from just
but some of these symptoms are, something that you may not peg on anemia. Feeling grumpy, feeling weak, headaches, problems concentrating or thinking. I mean, that sounds like
that's a great point.
Something that happens to people daily.
That's a great point. But if you've had this surgery, or even the lap band where they just put a rubber band around your stomach, in any kind of lap or gastric bypass surgery, you better be checked regularly for all your minerals, copper, vitamins, iron, B12.
I mean, if you don't have it, can they give it to you?
Yes, they can give you the iron, and they can give you B12 injections, and then you can put it under your tongue to have it dissolve. B12 is another common anemia here. You know why? Because we make something called intrinsic factor in the stomach that helps us absorb B12. You get rid of the stomach, you're not going to be able to absorb B12. Iron is the most common one, and we really have got to look for it and replace it. Remember, with anemia, it's very simple. You're either losing your blood somewhere, you're not making it properly, or you're destroying it in your bloodstream. In this case, you're not making it properly because an essential ingredient is missing.
All right,
usually
so it's
iron.
important to get checked, obviously, especially for this viewer who wrote in. Thank you.
Absolutely.
And of course, if you have a question for the doctors, you can email us. House Call is where you can email us at foxnews.com. And the doctors go through all the questions. They can't get to all of them on the air, but they get to most of them through the years. And we will, of course, keep your email address and your name. Well, maybe not your first name, but your last name and where you live and your email address and all that personal type of stuff. We keep that confidential, of course.